Welcome to At Issue. Thank you so much for joining us. I'm H. Wayne Wilson. It was June of 1981 when the Centers for Disease Control in Atlanta issued its first report on what was called PCP, later to be called AIDS, Acquired Immune Deficiency Syndrome. It was 6 years later. In fact, it was 30 years ago this year, in March of 1987, that the first effective drug was approved by the FDA, the Food and Drug Administration. It was referred to as AZT. We've come a long way in the treatment of HIV and AIDS, and we're going to have a discussion about where that has been, because it's been under the radar recently, and we want to bring that to the forefront once again with a discussion with Erin O'Malley. Erin is the Human Services Specialist at the McLean County Health Department. Thank you for joining us.
Thank you.
And also with Dr. Sharjeel Ahmad. Dr. Ahmad is the Medical Director for Positive Health Solutions. A brief definition of Positive Health Solutions, Doctor.
So Positive Health Solutions is a comprehensive HIV care center in Peoria, Illinois. It's under the auspices of University of Illinois College of Medicine, and we provide services related to prevention and treatment, and we also offer primary care medical services for our clients who are HIV positive.
And likewise, Erin, at the McLean County Health Department, the basic services that you provide.
I provide testing and prevention and education.
And we want to add that we had asked a representative, Chris Wade of Central Illinois Friends. That's also an organization that provides services. And Chris came down ill at the time of taping. So Chris, we hope that you are better by now, and we will carry on the conversation with the two individuals present, including Sharjeel. Is there a definition of HIV AIDS? I mean, we always saw HIV/AIDS. The differentiation and what the definition of each is?
So HIV stands for human immunodeficiency virus. An infection with HIV leads to your depletion of the immune system, because this virus attacks certain immune cells of the body called the T cells, CD4 cells. And over time, if your CD4 cell count drops below 200, you are more susceptible to various infections. We call them opportunistic infections, because these infections usually do not happen in a patient who has an intact immune system otherwise. So once you reach that state, the final stage of HIV infection, that's called AIDS. So the definition for AIDS is usually, say, your T cell count or CD4 cell count is less than 200. However, if you exhibit any opportunistic infection before your count drops to 200, you still classified as AIDS.
So this opportunistic word, are there certain people who should come into not just McLean County, but anybody that provides this service, who should be being tested to check these CD4 counts?
Anyone who's living positive should have their medical provider take care of their blood work and stuff. In regards to how often the doctor should be able to speak to that, anyone who is at risk should get tested for HIV. The issue of opportunistic infections comes into play when someone already has the virus. So
then those that don't know that they have the virus, but what at-risk groups? You mentioned at-risk. Who is this?
Anyone who has multiple partners, anyone who is injecting drugs, and then men who have sex with other men are at higher risk for HIV.
And I suppose we ought to talk about the origins. It was 1981, and all of a sudden it splashed onto the scene, but certainly it was around before the CDC made this determination. Do we have any idea where HIV/AIDS came from?
Yeah, we believe it originated from Central Africa, probably Congo. We think it jumped species from primates like chimpanzees to human, maybe in the late 1800s, but we didn't see the full-blown epidemic until the 1980s. So it may have caused like mini outbreaks locally, and then once you reach a particular threshold, then an epidemic can propagate by itself. And of course, global travel and stuff also made it easier for such kind of infection to
Was
spread.
that a case of eating chimpanzee meat, or?
Yeah, it was probably from exposure to what they call bushmeat over there, which is considered a delicacy. So probably in the handling of that meat, a lot of exposure to blood and stuff. So probably that's how it jumped species, and then it adapted.
In 1981, people who had AIDS, that was considered a death sentence. Is that correct? Mm-hmm. What has changed since then? I mean, it's no longer a death sentence.
No, it's a very manageable disease.
And when you say manageable, there's a regimen of drugs that you have to take, and
There is medications based on that person's needs, but it is something that we can detect early now, whereas before we didn't even know what was going on. And the sooner someone knows their status, then they can get on meds to help suppress that virus so that their immune system can live healthier.
And the impetus for this particular program was 30 years ago. AZT was the first FDA-approved medicine. Can you take us through the process of where medicine has come since AZT?
So, I mean, when AZT came out, it was the only drug that was available. It was used when person was really having severe problems with the immune system. So the medication was given at very high doses. It helped control the virus for a while, and then after a while, a few months, maybe a year or so, it would fail. And then, you start talking about hospice and goals of care and making the patient comfortable. The real boom came probably around 1996, when the concept of HAART, highly active antiretroviral therapy, came about, where we were using more than one medication, around 3 active medications to treat this infection. And that transformed HIV management.
And the HAART now has been shortened to ART, antiretroviral therapy. So it's multiple medicines, and there are different classifications of these medicines?
Yeah, there are about 6 different classes of drugs, and they act at different parts of the life cycle of the virus. So now, given that we have so many good options in each of these classes, we can pick and choose what medications to use and tailor the regimen according to the patient's needs and requirements and the overall picture, if they're pregnant or not pregnant, if they're taking other medications, drug interaction issues, mental health issues, other things as well. So we can tailor the regimen now according to the patient's needs.
So they might only take one pill, right?
Yeah. So the first one pill once a day, I believe, was around 2006, but now we have about 6 different one pill once a day regimens.
And they just pick from those different classifications, as you mentioned, depending upon their particular need.
Yeah.
So we've heard about the medicine, but they take meds, but there's still this fear. I mean, people are concerned, I'm HIV positive. What do you say to them? What kinds of services do you provide to somebody that says, oh my goodness?
Someone that comes in and tests positive has usually lots of questions, like, what do I need to do right away? What do I need to do to do this? The issue is that people are so afraid that they're going to be treated differently or they're going to be outcast or something, because there is so much stigma and there is not enough conversation about it's a manageable disease kind of a thing. And it's really not targeted to anyone. I mean, anyone who might have any kind of a sexual partner may be at risk because we don't know what our partners might be doing. So I just try to let people know what the changes are that have come forward in healthcare, and that it is a manageable thing. And yes, we have to change our lifestyle, but it's something that we all need to do in some way. Eat healthier, take care of our sleep, diet. If someone is drinking or doing drugs, that all affects our immune system anyway. So it's just something that people need to know, that it's okay and it's going to be okay. It's just we have to do these things in order to stay healthy.
So it's just another chronic disease like diabetes.
Mm-hmm.
I think people need to remember, HIV, this infection does not know any boundaries. We have teachers, lawyers, doctors, priests, everybody. So just because you think you are safe and you're involved in a particular profession or you have a certain lifestyle, you may not be at risk. Yes, it can affect anybody anytime. I mean, yes, you have to keep an eye for it, try to make sure you take measures to prevent. But again, this is a disease which does not know any boundaries.
At one time, we were concerned about people who went into surgery or were getting a blood transfusion of some kind. That's no longer a concern?
No, the thing is, again, the modern screening practices at blood banks has made risk of transmission through blood and blood products very, very low. So the risk from a blood transfusion is very, very, very negligible. I mean, I don't think we need to worry too much about the risk of transmission through blood and blood products these days in the U.S.
In 1985, we started to see people who were personalities either announce or die of AIDS-related illnesses or AIDS. Rock Hudson, Liberace, Magic Johnson came out and said he was HIV positive. And then maybe the most famous case was a young child, he was about 14, 15 years old, Ryan White of Indiana. His middle school, when he tested positive, his middle school said, you can't come to school. And that, of course, raised awareness nationwide. But it also raised the stigma. Ryan White is HIV positive. This is not a good thing. And Ryan White later died, of course, I think in 1988. What has changed in the last 25, 30 years that stigma, it may still be there, but is it different now?
I think it's different because people don't hear about it very much, but it's still there. When Ryan White was in school, certain laws and things had to be put into place to protect people's rights. So that was something that guaranteed anyone living positive should have the equal opportunity to everything. So what's changed is we're not talking about it very much anymore. And because we don't talk about it, people just think it's not there or it's gone away or I don't have to worry about it. So,
with regard to stigma, your take on what's happening?
Yeah, I think as far as HIV is concerned, it's kind of a victim of its own success. We have such good medications available now. It's more like a chronic disease, just like hypertension or diabetes. You take your medications, keep the virus suppressed. You should consider yourself to have, a normal life otherwise. So the problem is now that we're not hearing about it being a death sentence anymore. It's kind of gone off the radar. That's where the problem lies, I think, a lot as well. Because in the 80s or even in the early 90s, yes, you heard about all the celebrities and everybody else. And now, again, most of our HIV patients are not dying of AIDS or AIDS-related illnesses. They're dying of, the stroke or heart disease and other complications, which could be just part of aging process otherwise, provided they are taking their medications. So again, it's gone off the radar. I mean, Magic Johnson, for example, that was a big thing when he came out, but now does anybody even remember that? Probably not.
Well, the younger people certainly wouldn't remember that.
I have a lot of clients who come in and say, well, Magic Johnson is still living, so he must have got really good treatment or special treatment. And the key with him was he came out having it very early on and was able to get into care and know what he needed to do or not do and stuff. And yeah, he is living pretty healthy. So he does take meds, and he actually is someone in the forefront for certain med companies to promote medications. So
and you mentioned, we talked about it a lot back then. In 1987, Congress allocated $30 million toward it. That had big headlines. 1991, I think we hit the 100,000 cases threshold across the country. But we haven't heard much about it. Has that impacted the ability to raise funds? I mean, where does the money come from?
So if you look at the latest stats, most of the funding for HIV and AIDS over time, there are three big sources actually for the treatment and stuff. Medicare is actually number one, then Medicaid, and then the Ryan White program. So that's involved. So those are the three big sources of your funding for HIV care in this country at this point.
And do you get money, money locally other than through the money that supports the health department?
I work under 2 grants from the state and through the CDC to provide prevention programs. So that allows me to provide that education and that testing and stuff. So
And those state funds are still there?
we're promised them. We're waiting. Sometimes
But you
they're on
continue to
hold.
offer the services?
Our health department is able to continue offering those services. We've had to scale back a little bit, but we're still able to do that. And because of that, education and prevention is really most important. And that's part of why it needs to get back out there, because we need to educate people that there are meds available and there is services available and no one is denied care. So
You mentioned earlier high-risk populations. In the general population, should people be concerned and say, I need to rush over to the McLean County Health Department and get tested? Or why should someone get tested other than the high-risk categories that you already mentioned?
I think that anyone who goes in for a physical or any kind of blood work done, I think that should just be part of our wellness checks. And because of the unknown, as our partners, spouses have been faithful or not, kind of a thing, we might not have that behavior, but someone else might, would be a good way to pick that up.
So part of the, hey, personal doctors say, well, I'm going to test my blood sugar level, my cholesterol level, and check for HIV.
Yeah, I think every adult should probably get that testing at least once in their life. And then if you have certain risk factors, then of course you have to do it more frequently. I'll give you an example. I worked at a community health center in Connecticut for 4 years. We were able to get some funding from the local health department. So we made HIV testing. It was a rapid HIV test. You get the results as part of the vital signs. So the patient is coming in, they're getting their blood pressure, temperature, whether it's an urgent care visit or a regular follow-up visit. So everything is done. They're like, okay, and we would offer them HIV tests. So everything is done. So you had your blood pressure, temperature measured, your blood sugar checked. Do you want to get an HIV test done? We'd offer that. And we picked up a lot of patients. The oldest patient I know we picked up that way was an 87-year-old.
Really?
No diagnosis.
An 87-year-old who was HIV positive
Yes.
and did not know it.
Did not know it.
Are there symptoms when you're HIV positive? You haven't been tested yet. Are there symptoms that you say, well, something's wrong?
Yeah, I mean, the symptoms are non-specific. So when you get the initial infection, maybe a few weeks after that, you can get what is called an acute retroviral syndrome. It's more like a mono-like illness. So, you get the fever and the sore throat, and these lymph nodes are swollen up and they're not going away. So you may just brush it off as another viral illness. So that can happen very early in the disease. And then once at that point, the body starts to recognize this virus is there and tries to fight it off. So yeah, you may not have symptoms for a long time after that. But yeah, if you start having recurrent infections or any weird infections, as we talked about, opportunistic infections, that's a warning sign. But, unexplained fever, unexplained weight loss, unexplained lymph node enlargement, recurrent infections, those could be a manifestation of uncontrolled HIV.
But some of those could disappear over time because the body's fighting it back, and you say, okay, it was the flu, it was something. And then would you eventually have other issues because you're not taking meds?
Yeah. So let's put it this way. So yeah, initially, as I said, when you have the acute flu-like illness, those symptoms may be there for a few weeks and it goes away. And then, very late in this stage of disease, they may have symptoms from AIDS, bad infections and the fever and stuff. One of the things which you learn in training is that HIV is always on a differential when we think about, okay, this person has these symptoms, what could be a differential? We always think of HIV as one of the differential. Any unexplained fever, any unexplained anemia, any unexplained bone marrow abnormality, any unexplained lymph node enlargement you see visibly or you see on a CAT scan and stuff. So we always keep that at the back of the mind because HIV because it affects your immune system, it can affect actually virtually any part of your body. So any unexplained chronic symptoms, we always have that at the back of the mind. Now that being said, of course, it's these symptoms, as I'm telling you, they're very non-specific. But again, you look at the whole picture. So when the patient comes to us, we hear about, okay, I've had unexplained fever, I'm losing weight, doctor, I'm having this cough which is not going away. And then, as a healthcare provider, this is our job to explore it further. Ask them about their social history, ask them about their sexual history. I think part of the responsibility also lies on the healthcare provider because we are also very hesitant about asking those difficult questions.
I don't want to scare the audience,
Yes.
but there aren't that many, I mean, compared to the population, there aren't that many cases of HIV positive in the area, are there?
I always say how many is enough, but in our area, in McLean County, I believe that we have at least 200 plus individuals living positive.
In Sharjeel, you do this by regions? How many number?
Yeah, so at our clinic, actually, we served about 630 clients last year.
630?
Yep. And according to the IDPH surveillance data for our region, we had in this area, about 410 patients are HIV positive only, and 442 patients have AIDS. So they have HIV, which is in the final stages. So a total of about 852.
852, according to Illinois Department of Public Health. So it isn't a widespread epidemic, but we still need to be cautious.
Yes.
I'm a little bit concerned about the funding because this is a chronic disease, and you said the state of Illinois is in arrears. And we're not too surprised at that. And the McLean County Health Department has a commitment to this, though?
They do, and they always have. They've been involved in it from the get-go, and we will continue to provide services as long as we can. The grants that we work under for HIV are allocated for us. It's just a matter of being released from the state to pay for those services. So I used to have more coworkers doing HIV testing and stuff, and now it's just down to one or two of us. So it's scaled down a bit. But the biggest hurt from that funding has to do with outreach, meaning getting out into the community and educating people and providing some of those services for those people who might not want to come in.
And
So.
do you reach out into the community and educate at Positive Health Solutions?
Yeah, we do. We have an outreach program. And actually, that's the thing, I want to make sure everybody's aware of it. Anybody who wants an HIV testing, they can come to Positive Health Solution or even any local county health department. It's free. We do not charge the person for the HIV test.
Are there tests that come from other places? You go on the internet and say, hey, we'll send you a test. Are those legitimate?
So actually, there are home testing kits available now for HIV. You can do the test yourself, and then once it's positive, so those tests are very reliable and very sensitive. So home testing actually is a new way. We've had a few patients who've had the testing done, is positive, and then they seek our care saying, my test was positive, so what do I do next?
In 1991, the red ribbon became the symbol. Is that still the case, or has that kind of faded away?
It's there, but it's kind of faded back because it was a symbol that represented people who were dying, and people don't want to be reminded of that, and that's kind of where some of that stigma comes in, and also, we don't want to talk about it kind of a thing. So, but it's still out there, yeah.
And one thing we haven't talked about is that if you're testing positive for HIV, what kind of lifespan do I expect? Assuming you get the test is positive early in the process.
So it's come a long way. So right now, for example, if you test positive at age 20 and you get your medications, you take them regularly, that's the key to keep the virus suppressed. We're talking about at least 50, 60 additional years, okay? Now, let's say that right now in the US, that's still about a decade less than the normal individual who doesn't have HIV, but I think that gap is going to close. So the life expectancy, of course, is also going to be dependent on other things. How early in the infection you were diagnosed at, what are the risk factor? Are you using any drugs? Are you using any alcohol to abuse your liver? So those things, certain genetic factors can also contribute, but I don't think there's any reason why, in this day and age in the US, anybody who has HIV should die of AIDS.
And HIV positive, the progression to AIDS is what's the definition of going from one to the other?
So as your T cell counts deplete, so you can progress from just HIV infection to AIDS.
But it has to do with CD4.
CD4 counts, yeah.
Okay, all right. And with that, we thank both of you for the discussion. I appreciate it.
you.
Aaron O'Malley of the McLean County Health Department, thank you so much for joining us.
Thank you.
And Dr. Sharjeel Ahmad of Positive Health Solutions at the University of Illinois College of Medicine at Peoria. Thank you for the conversation, and we hope that you learned a bit more about HIV and AIDS because of this conversation. We'll be back next time with a look at changing trends at cemeteries. Cemeteries aren't burying as many people as they once were, mainly because of cremation. We'll talk about the impact on cemeteries in Springfield, Bloomington, and Peoria next time on At Issue.